The Stephenson Cancer Center is located at the Oklahoma Health Sciences Center campus in Oklahoma City. Stephenson Cancer Center is a new cancer center that is seeking to become one of the National Cancer Institute's officially designated cancer centers. Dr. Adam Ash, Senior Deputy Director of the Stephenson Cancer Center, says it is exciting to be involved with a dynamic, rapidly evolving institute as it pursues this goal.
We're a new cancer center, and we're striving for a comprehensive cancer center designation. And that's exciting in and of itself, and the opportunity to be on the ground floor as that launches is a really once-in-a-lifetime opportunity. Physically, this is a gorgeous facility. From a clinical standpoint, we have superb staff, and the people both in my division and the other doctors with whom I have the opportunity to work are really terrific. And in combination with that, and consistent with a comprehensive cancer center goal in mind, the research, both basic and translational, is really exciting.
In the brain tumor clinic at Stephenson Cancer Center, treatment is individualized to each patient and each disease, using a team-based approach, according to Dr. James Batiste, who is the only physician in Oklahoma who concentrates only on the treatment of malignant brain tumors.
With the treatment of brain tumors specifically, we've developed a multidisciplinary clinic to treat brain tumors. So we want to treat patients with tumors with as many different options as possible and have as many different people looking at it. So we have a neurosurgeon, a radiation oncologist who focuses on brain tumors, and then myself, who is a fellowship-trained neuro-oncologist. All trying to focus on treating brain tumors as best as we can. And we really believe that a team approach is the best way to treat a patient, and hopefully get the best outcomes with that too. In addition to that, we have many clinical trials ongoing, and some of them require coordination between all of the team, including the neurosurgeons. So I think that our patients have exposure or the ability to get treatment at the highest level.
Another area of high-level focus at Stephenson Cancer Center is tobacco research. The Oklahoma Tobacco Research Center, or OTRC, is committed to reducing the burden of tobacco-related health problems in Oklahoma. Dr. Ted Wagner, co-director of development and research development at OTRC, discussed his experience at the center.
I love the cancer center here. In the center, within the cancer center, so there's the Oklahoma Tobacco Research Center too. But with Dr. Mantle, Dr. Mantle, obviously the director of our cancer center, and then the other co-directors, including myself, it's been outstanding being here. I came here from Brown University, and where there were plenty of people that were doing tobacco research. And I came here, and there was a strong interest in doing tobacco research and a huge problem here in Oklahoma. But there was only a handful of folks doing tobacco research. So over the last few years, we're starting to build the infrastructure, get the funding to recruit more tobacco researchers. So actually, things are looking pretty good that over the next 5 years, we're going to recruit 10 to 12 more tobacco researchers to the Cancer Center, to OTRC, to do some of this work that not only is important for the country, but is important for our state. We still have one of the highest tobacco prevalence rates in the country, and so if we can start bringing that down a notch, that might be through regulations, but hopefully it's also because of good work that we do in cessation efforts, but then also in our research, helping provide people the information that they realize that things like hookah isn't good for them, but also potentially providing them resources and providing research at a level that regulators take note and make decisions based on the available science.
Dr. Robert McCaffrey, who works with Wagner, spoke more broadly about how the Stephenson Cancer Center has made a difference in the lives of patients and families in Oklahoma by providing local access to state-of-the-art cancer care.
The Stephenson Cancer Center is a comprehensive cancer center, the only academically oriented or focused cancer center in the state. And up until its development, patients had to travel to surrounding states to get cutting-edge cancer treatment. The Stephenson Cancer Center brings all of this to the people of Oklahoma, so they don't have to travel so far. We are the only phase 1 trial center in the state. We are also a NCI designated leader in the National Clinical Trials Network. So all of these cutting-edge therapies are now available for people in the state without having to travel to one of the surrounding areas, traveling usually thousands of miles, certainly hundreds of miles, to get to another cancer center with the the whole panoply of services that we have at Stephenson Cancer Center.